As the coronavirus continues to wreak havoc globally, concerns over vaccine disparity across the world are also intensifying. Those concerns are part of the reasons why President Joe Biden is bringing the U.S. back into the World Health Organization vaccine initiative, COVAX. The president's decision to help donate vaccines to poor countries reverses former President Trump's America First approach. This all comes as America is struggling through its own vaccine challenges. In a statement last week, WHO's Director General called out the lack of vaccine equity, stating it's, quote, not right that younger, healthier adults in rich countries are vaccinated before health workers and older people in poor countries, warning of a, quote, catastrophic moral failure. With more on the reality of the global vaccine inequity and calls for people's vaccine, we're joined by Oxfam America Senior Advisor Niko Lusiani. Niko, Oxfam has analyzed the deals that pharmaceutical corporations and vaccine producers have struck with nations around the world, and it found that parts of the world's population are likely to not have a vaccine until at least 2022. So what more can you tell us about this possibility?
Well, I think what the WHO is signaling is really important. This could be one of the biggest moral catastrophes of our lifetime. We're seeing a slow roll out in the U.S. and Europe, already causing lots of frustrations, as you saw in the streets of Europe here in the United States. But putting this a little bit into perspective, rich countries and some relatively rich countries have received, around 70 million doses so far administered into arms. If you look into the lowest income countries, you have 55 people to date. Not 55,000, not 55 million, but 55 people have received a vaccine to date. That even shocked me, and I've been tracking these things for months. We are really moving towards a vaccine apartheid situation if nothing changes. The good news is the steps we take today can really make all the difference for the future.
This pandemic has truly tested the business model for these pharmaceutical companies, right? The whole idea is you put a lot of money into research and development, you create a drug or a vaccine, and then you get exclusivity when it comes to selling it. But we have a pandemic, and so we need a global plan to tackle it. Some, including Oxfam, have suggested that what we really need is a people's vaccine, a vaccine that's free, that's just distributed fairly based on need. But these are private companies. They spend a whole lot of money to come up with this vaccine. Is that a realistic concept?
Yeah, thank you very much. I mean, we've joined not only organizations around the world, frontline workers around the world, but heads of state, former and current, to call for a people's vaccine, as you say, which is free of charge to the public, which is fairly distributed based on need and risk, not on nationality or on price, and that is a global public good, as you say. Basically, a kind of a generic form of these vaccines, which would be cheap and quickly produced in a distributed manner all over the world. As you say, the pharmaceutical industry wants to be able to have a return on investment, but here's the catch. Most of these, if not all of these vaccines, have received millions and millions of dollars of taxpayer money from you and I that we invest in our government, which then have invested in the production of these vaccines and the manufacturing of these vaccines, and then in the buying of these vaccines. Our government, the public, you and I are the market makers for this. So the idea that private companies should profit extraordinarily off of a public investment during a time, as you say, of a public health emergency, we think is nonsense. And there are examples, whether it's the flu vaccine we get every month, or think back to the polio vaccine, when Jonas Salk said very clearly, we cannot patent the sun. Scientific discovery is given to us. We just channel it, and he decided to leave all of the profits aside and give away the recipe of how to make the polio vaccine to the world. And we have seen in the last months how dangerous it is to assume that there's a fixed pie of vaccines which the world scrambles over cutting up. It ends up being the poorest and the most marginalized that suffer. So instead, we need to grow that pie, and we need to do that by sharing the recipe of how to make it and the know-how of how to make these vaccines all over the world. So certified producers the world over that have excess capacity right now can come online and really start protecting everyone.
As you know, the U.S. COVID death toll has surpassed 420,000. It's the highest of any other nation. And yet public health experts argue that high-risk groups in poor countries should get the vaccine before the U.S. If you can help our audience understand this way of thinking and why it's important.
So first of all, I mean, it's devastating what's happening in our own country, right? Almost a quarter of the deaths worldwide are in the United States, and we only have 4% of the population. So this is some lessons of of the recent past that the Biden administration is quickly learning, and really trying to focus as much as possible these vaccines to people that are at the most risk, or healthcare workers, et cetera. And we're not there yet. We haven't vaccinated everyone that's truly at risk and truly at need yet in the United States. So that definitely needs to be the focus. However, I ask you, for if you're working in the technology industry, or you're working behind a screen, even myself and my coworkers at Oxfam that are not on the ground, we're working behind a screen. Is it fair that we would be vaccinated before a healthcare worker in a slum in Kenya, for example, or for that matter, an older person in Lima, Peru? Is that really the way we want to move forward? It's not only going to be devastating morally for those people that won't receive the vaccine and will die as a result. It's also, really an economic failure. And just this week, the International Chamber of Commerce commissioned a report that showed that if we continue down this path of the rich countries vaccinating their whole populations, where the poor countries are basically left out in the dust, that could mean economic losses of $9 trillion over the next year or two. Half of that is experienced in rich countries, including the United States. So COVID-19 is COVID-19 anywhere, is COVID-19 everywhere, but the economic shocks of COVID-19 are going to continue with us until we really scale up production and flood the market, so to speak, around the world with protection through a vaccine.
So President Biden says now that he wants to join the COVAX project, pledging to give vaccines free of charge to poorer nations, all while, America is facing its own vaccine shortage. If the U.S. is striving to vaccinate 300 million people and reach herd immunity by the summer, is this a realistic move, do you think, by the president?
So I think it is very much realistic. COVAX is set up as a vaccine kind of a sharing arrangement, as you know, and with a basic idea of being able to vaccinate 20% of the most at-risk people around the world. That can happen, as we're saying, that can happen not at the expense of Americans, but really to support Americans as well. There are certain vaccines that we don't have yet access to, that we can get access to through COVAX. And as I said before, the more we can tamp down this virus everywhere in the world, the safer Americans are and the more economic prosperous we will be. So we think it's a great move, and we think that there's actually some next steps that the Biden administration can take, which is, in particular, joining something which is adjacent to COVAX, which is called CTAP, or the Coronavirus Technology Access Pool, which would actually pool the vaccine technologies so that, as I mentioned before, we could have generic producers come online to start producing them ASAP, and then we wouldn't have this dog-eat-dog war or scramble over vaccine resources. We would slowly but surely be able to produce enough for everyone.
Moderna is one of the approved COVID-19 vaccines that the U.S. is widely using, and although Moderna and the WHO still have not come to a formal agreement, could this limit the extent to which the U.S. can help the global vaccine push?
The Moderna vaccine, as you know, is really tailored to a particular demographic, a particular type of countries which have the type of logistical chains to be able to uptake them. The company hasn't moved yet to allow for low and middle income countries to access their vaccine. It'll probably be there, but it's only really going to meet a very small portion of the population, say health workers in urban areas where you can really get these vaccines to people in mass settings. And so, that there are other vaccines, as you know, that are coming online. We're very hopeful for, which will very quickly, hopefully, be able to be more accessible to the rest of the world.
Niko, I think this is a really, really interesting topic. I remembered in the summertime experts warning of vaccine nationalism, particularly when you had wealthy countries investing in the development, like you pointed out, in the development of vaccines, and would they demand the lion's share of the vaccines once they were produced? So I'm really glad that Oxfam is taking on this topic. Niko Lusiani, thank you so much, Niko.
Thanks for having me. Be well.